In terms of targeted therapies, this ASCO we're also seeing the long-term data from the combination of Dabrafenib and Trametinib from the very early phase 1-2 trial. We're seeing the 5-year overall survival. Basically what that tells us is there is a small proportion of patients who do benefit from targeted therapies long-term, particularly those who have low volume of disease and a normal LDH at baseline. The same subset that do really well long-term on immune therapy, although I don't think the numbers doing long-term are quite as high, but we have to wait and see. The second big finding this ASCO for targeted therapy, particularly the combination of Dabrafenib and Trametinib, is the activity of those drugs together in the brain. And what we see is a fantastic response rate, 58% of shrinkage if you have the V600E mutation in your melanoma and have metastases to the brain, which is phenomenal. However, it doesn't look to be very long lasting. The progression-free survival at 6 months is 46%, but by the time you get down to 12 months, it's really much less than 20%, which is different to what we're seeing in the immunotherapy brain trials. So that's the ASCO wrap-up. Great long-term results for all our drug therapies and activity in the brain, which is great for that unmet clinical need. One other comment. We are looking at combinations of radiotherapy and immunotherapy and the adverse events, so radionecrosis. So there's a poster discussion on that, which really highlights what are the features of an MRI that tell you whether this is disease progression in the brain or is this simply a side effect from radiotherapy and radionecrosis. So again, important, very clinical material to help clinicians manage their patients.